I'm going to move now to a couple of quick updates related to testing. I spoke a little bit earlier about just the screening test that's being done on samples that are submitted through the provincial laboratory system. I think the other hot topic related to testing is rapid antigen testing. And I know I'm certainly receiving a lot of email questions about it and seeing lots of discussion on social media and other media sources. So a reminder that rapid antigen testing is used for people that do not have symptoms, are not identified as a high-risk contact, and really they're used as a form of surveillance testing. There are some other jurisdictions that have really made rapid antigen tests widely available to the public, and we have not had that same strategy in Ontario. At this point in time, at least throughout HKPR jurisdiction, there's a couple of key focuses for rapid antigen testing. One is through the school system. I'm sure people are familiar that the Ministry of Education has distributed rapid antigen tests to every school. For them to be sent home with every elementary or every student for over the winter holidays. The intent is for students to do a rapid antigen test every couple of days. Each student is sent home with 5 tests. This is partly to monitor now that they're home to ensure that there's nothing kind of left over from the school year, and also really to ensure a safe return to school in January, given that there might be other exposures during the winter holidays. I am highly encouraging students and families to participate in that rapid antigen testing program. I think that it is a key tool, one of our many tools that we can use to identify COVID-19 early. A couple of strong reminders. So one is that if you test positive on a rapid antigen test, you need to have a PCR test done at an assessment center to confirm the results. And the other is that if you do have symptoms, that you should be going to an assessment center for a PCR test and not to rely on the rapid antigen test. The other more recent news related to rapid antigen testing is the expansion, again, of rapid antigen tests at long-term care homes. So with the emergence of the Omicron variant and recognizing that 2 doses of vaccine is less effective at preventing infection as well as symptomatic illness, the Ministry of Long-Term Care has implemented additional precautions, including the use of rapid antigen tests for staff and caregivers, regardless of whether or not they have been vaccinated. And this is an extra precaution. In addition, I know the ministry is re-looking at the use of rapid antigen tests in light of Omicron through other health sector partners, and they've continued to encourage their use through businesses through the Ontario Rapid Antigen Screening Program. I've had a couple of inquiries as to whether or not the health unit will be distributing rapid antigen tests or providing any pop-up locations. So we do not have any rapid antigen tests actually at the health unit. They have not been distributed through the health unit. Any of the rapid antigen tests that have gone to schools come directly from the Ministry of Education to the school, similar for long-term care homes, hospitals, in those other settings. There was or is a pilot that the Ministry of Health has done in some jurisdictions where they are offering pop-up rapid antigen test locations in public settings. So, for example, there are some mall locations, not in HKPR jurisdiction. I believe there's one in Peterborough, and I'm not sure about Durham, where the ministry intends to hold a pop-up site to distribute rapid antigen tests. My understanding at this point in time is that that initiative isn't continuing, but I don't have further details about it. And I know that none of the locations kind of selected as a pilot have been in HKPR jurisdiction. Otherwise, I know that our partners at our assessment centers are continuing to work diligently to ensure access to testing, PCR testing, and know that, over the next couple of weeks, it's likely to be a challenge for them with likely increased demand for testing, holiday season, and some of the other non-COVID related illnesses that we sometimes see a surge of over the winter holidays.